If you're over 60 and still trying to hit a perfect blood pressure of 120/80, you might actually be putting yourself at risk without realizing it. That number has been repeated for decades as the gold standard, the ideal target everyone should aim for. As you get older, your body changes in ways that make that number not only unrealistic for many people, but sometimes even dangerous to chase too aggressively. In this video, we are going to break down what really happens to blood pressure after 60, why the rules change, and what targets actually make sense if your goal is to stay healthy, stable, and independent. Let's start with what blood pressure actually represents. When you see a number like 120/80, the top number is your systolic pressure. That is the force of blood against your artery walls when your heart beats. The bottom number is your diastolic pressure, which reflects the pressure when your heart is resting between beats. Both numbers matter, but they do not behave the same way as you age. As people get older, arteries naturally become stiffer. This is a normal part of aging. The walls of your blood vessels lose some of their elasticity, which means they do not expand as easily when blood is pumped through them. Because of this, systolic pressure tends to rise over time. You might see numbers like 130, 140, or even slightly higher, even in otherwise healthy individuals. At the same time, diastolic pressure often stays the same or even decreases slightly. This creates a wider gap between the top and bottom numbers, something known as pulse pressure. And this is where things get interesting, because aggressively lowering the top number without considering the bottom number can create problems. Here's the key point. Your organs, especially your brain, rely on adequate blood flow at all times, not just when your heart is beating. If diastolic pressure drops too low, the brain may not receive enough blood during those resting phases between heartbeats. This can lead to symptoms like dizziness, lightheadedness, and even fainting. In older adults, that significantly increases the risk of falls. So when someone over 60 is pushed to reach a strict target like 120/80 using medications, what can happen is that the systolic number comes down, but the diastolic number drops too far. This creates a situation where blood pressure looks perfect on paper, but the person feels worse in real life. Now let's talk about why the 120/80 target became so popular in the first place. It is based on large population studies showing that, on average, people with lower blood pressure tend to have lower rates of heart disease and stroke. But averages do not apply equally to every individual, especially when age, frailty, and other health conditions come into play. More recent research has shown that in older adults, especially those over 60 or 65, the relationship between blood pressure and health outcomes becomes more complex. Very high blood pressure is still clearly harmful. But very low blood pressure can also increase risk, particularly when it leads to symptoms or reduced blood flow to vital organs. This is why many experts now recommend more individualized targets rather than a one-size-fits-all number. For some people, a systolic pressure in the range of 130 to 140 may be perfectly acceptable, especially if it allows them to feel stable, think clearly, and avoid side effects from medications. Another factor to consider is how blood pressure is measured. Many people only see their readings at a clinic where stress and anxiety can temporarily raise blood pressure. This is known as white coat hypertension. On the other hand, some people have normal readings in the clinic but higher levels at home, which is called masked hypertension. For older adults, home monitoring can provide a much clearer picture. Measuring your blood pressure at the same time each day in a relaxed setting can reveal patterns that a single clinic reading might miss. This helps ensure that treatment decisions are based on accurate information, not just isolated numbers. Now let's talk about symptoms, because they matter more than many people realize. If you are on blood pressure medication and you feel dizzy when you stand up, if you feel unusually tired, if you have episodes of blurred vision or weakness, those are not things to ignore. They may be signs that your blood pressure is being lowered too much, especially in certain positions like standing. There is a condition called orthostatic hypotension, where blood pressure drops when you move from sitting or lying down to standing. This is more common in older adults and can be worsened by blood pressure medications.
It increases the risk of falls and injuries, which can have serious consequences. This is why treatment should always balance benefits and risks. Lowering blood pressure can reduce the risk of heart attack and stroke, but only if it is done in a way that does not compromise stability and daily function. Another important point is that not all blood pressure medications are the same. Different classes of drugs work in different ways. Some relax blood vessels, some reduce fluid volume, and others affect heart rate. The choice of medication, the dose, and the timing all matter. For example, taking certain medications at night rather than in the morning may help control blood pressure more evenly without causing daytime symptoms. In other cases, adjusting the dose or switching to a different medication can reduce side effects while still providing protection. Lifestyle factors also play a huge role, and in many cases, they can reduce the need for higher doses of medication. Regular physical activity helps keep blood vessels flexible and improve circulation. Even simple activities like walking can make a meaningful difference over time. Diet is equally important. Reducing excess salt intake can help lower blood pressure, especially in people who are sensitive to sodium. Eating more fruits, vegetables, and whole foods provides nutrients that support vascular health. Hydration is something that is often overlooked. Dehydration can cause blood pressure to drop, especially in older adults. This can worsen dizziness and increase the risk of falls. Making sure you are drinking enough fluids throughout the day is a simple but powerful step. Stress management also matters. Chronic stress can raise blood pressure over time, while relaxation techniques can help bring it down. This does not have to be complicated. Deep breathing, spending time in nature, or engaging in activities you enjoy can all have a positive effect. Now, here is something that may surprise you. The goal of blood pressure management after 60 is not perfection, it is stability. It is about finding a range where your risk of long-term complications is reduced, but your day-to-day function remains strong. That means being able to stand up without feeling dizzy, being able to walk confidently without fear of falling, being able to think clearly and stay engaged in daily life. These outcomes matter just as much as any number on a chart. This is why it is so important to have personalized conversations with your healthcare provider. Instead of asking, "What should my blood pressure be?" a better question might be, "What range is safest and most appropriate for me, given my age, my health, and how I feel?" If you are currently aiming for 120/80 and doing well, that is fine. But if you are struggling with side effects, or if reaching that number requires multiple medications that make you feel worse, it may be worth reassessing your target. Your body is giving you feedback all the time. The key is to listen to it. Numbers are important, but they are not the whole story. So stop chasing a number just because it sounds ideal. Start focusing on what actually keeps you healthy, stable, and independent. Because at the end of the day, the goal is not just to control blood pressure, it is to protect your quality of life. There is another important piece of the blood pressure puzzle after 60 that almost nobody explains clearly, and that is variability. It is not just about what your blood pressure is, it is about how much it fluctuates throughout the day and from day to day. Two people can have the same average blood pressure, but one may be far more stable while the other swings up and down constantly. And those swings can actually be just as important as the number itself. As we age, the systems that regulate blood pressure become less responsive. The nervous system, which helps adjust pressure when you stand, move, or experience stress, does not react as quickly as it used to. This means your body may struggle to keep blood pressure steady in different situations. You might be perfectly fine sitting down, but feel dizzy when you stand. Or your pressure might spike higher than expected during stress or physical activity. These fluctuations can put strain on the blood vessels and increase the risk of both cardiovascular events and falls. That is why stability is often a better goal than chasing a perfectly low number. A slightly higher but steady blood pressure is often safer than one that drops too low at times or swings unpredictably. Now let's talk about timing, because when your blood pressure rises and falls during the day matters more than most people realize. Blood pressure naturally follows a rhythm. It tends to be lower during sleep and rises in the morning as your body wakes up. This is known as the morning surge, and in some people, especially older adults, this surge can be quite pronounced. A sharp rise in blood pressure in the early morning hours has been linked to a higher risk of heart attacks and strokes. This is one reason why simply measuring your blood pressure once during the day does not give the full picture. Understanding your pattern over 24 hours can provide much more useful information. Some people benefit from what is called ambulatory blood pressure monitoring, where a device measures blood pressure at regular intervals over an entire day and night. This can reveal patterns that would otherwise go unnoticed, such as high nighttime blood pressure or exaggerated morning spikes. Nighttime blood pressure is particularly important. In healthy individuals, blood pressure should dip during sleep. If it does not, or if it remains high, this can increase the risk of cardiovascular problems. In older adults, this pattern is more likely to be disrupted, especially if there are underlying conditions like sleep apnea. Speaking of sleep, poor sleep quality can have a significant impact on blood pressure. Conditions like sleep apnea, where breathing repeatedly stops and starts during sleep, can cause repeated drops in oxygen levels. This triggers stress responses in the body that raise blood pressure over time. Many people with sleep apnea are unaware of it. They may snore loudly, wake up feeling unrefreshed, or feel excessively tired during the day. Treating sleep apnea, often with devices that support breathing at night, can lead to meaningful improvements in blood pressure without adding more medication. Now let's go back to medications for a moment, because how they are used can make a big difference. It is not just about which medication you take, but how aggressively it is used. Sometimes multiple medications are added to push blood pressure lower and lower without fully considering how the person feels. In older adults, there is a concept called start low and go slow. This means beginning with lower doses and adjusting gradually while monitoring for side effects. This approach reduces the risk of sudden drops in blood pressure and allows the body to adapt more comfortably. There is also increasing recognition that overtreatment is a real issue. In some cases, medications are continued at the same dose, even when a person's health status has changed. For example, someone who has lost weight, improved their diet, or become more active may no longer need the same level of medication. But unless this is reassessed, they may continue taking more than necessary. Another factor that can influence blood pressure is body position. Blood pressure can be different when you are lying down, sitting, or standing. In older adults, these differences can be more pronounced. That is why it is sometimes helpful to measure blood pressure in more than one position, especially if symptoms like dizziness are present. Let's also talk about salt, because it is often oversimplified. While reducing excessive salt intake is important, especially for people with high blood pressure, going too low can also cause problems in some older adults. Sodium plays a role in maintaining fluid balance and blood pressure. Extremely low intake, particularly in combination with certain medications, can contribute to low blood pressure and Kamsori. The key is balance, not extremes. A moderate, consistent intake that avoids excess is usually more beneficial than strict restriction that is difficult to maintain and may lead to unintended consequences. Potassium is another nutrient that deserves attention. It helps balance the effects of sodium and supports healthy blood vessel function. Foods like bananas, spinach, and beans are good sources. However, potassium levels can be affected by kidney function and certain medications, so it is important to approach this thoughtfully and, when needed, with medical guidance. Let's not ignore the role of emotional health. Chronic stress, loneliness, and anxiety can all influence blood pressure. After 60, life changes such as retirement, loss of loved ones, or reduced social interaction can increase emotional stress. This can lead to sustained increases in blood pressure over time. Building strong social connections, staying mentally engaged, and finding purpose in daily life are not just good for emotional well-being, they also support physical health, including blood pressure regulation. Now, here's a practical mindset shift that can make a big difference. Instead of asking, how low can I get my blood pressure? Start asking, how well is my body functioning at this level? Are you steady when you walk? Are you thinking clearly? Do you feel energetic enough to do the things you enjoy? These are powerful indicators of whether your current blood pressure and treatment plan are working for you. It is also helpful to look at trends rather than single readings. Blood pressure naturally fluctuates, so one high or low reading does not tell the whole story. Tracking your readings over time can reveal whether your pressure is generally stable, rising, or falling. This information is far more useful when making decisions. If you notice consistent patterns, such as low readings in the morning or high readings at night, that is something to discuss with your healthcare provider. Adjustments can often be made to better match your body's natural rhythm. And finally, remember that your goal is not to meet a number on a chart. Your goal is to reduce risk while maintaining quality of life. That means protecting your heart and brain while also preserving your balance, your clarity, and your independence. So if you have been told that 120/80 is the only number that matters, it is time to update that thinking. After 60, the truth is more nuanced. The safest approach is one that considers your entire health picture, not just a single target. Because the best blood pressure for you is not just the one that looks good on paper. It is the one that allows you to live your life fully, safely, and with confidence every single day. When you are younger, your body is very quick to adjust. You stand up, your blood vessels tighten, your heart rate adjusts, and blood flow to the brain stays steady. After 60, this response can slow down. That delay might only be a few seconds, but it is enough to make you feel lightheaded or unsteady. And if you are taking medications that lower blood pressure, that delay can become even more noticeable. This is why some people feel perfectly fine sitting or lying down, but experience dizziness the moment they stand or start walking. It is not always that their blood pressure is too low all the time. It is that their body cannot adjust quickly enough in that moment. And if your treatment plan is focused only on lowering numbers without considering this response, it can increase your risk of falls. Another important factor is how your daily routine affects your blood pressure. Simple things like when you eat, how much water you drink, and how active you are during the day can all influence your readings. For example, large meals can sometimes cause blood pressure to drop temporarily as blood is redirected to the digestive system. In older adults, this effect can be stronger and lead to post-meal dizziness. Similarly, long periods of sitting can cause blood to pool in the lower body. When you finally stand up, your system may struggle to push that blood back up quickly enough. This is why gentle movement throughout the day can actually help stabilize blood pressure more than staying still for long periods. So instead of focusing only on reaching a specific number, shift your focus to maintaining a level where your body performs well throughout the day. That is the real goal after 60. Not perfection, but stability. Not the lowest possible reading, but the safest and most functional range for you. Because in the end, good blood pressure control is not just about preventing future problems. It is about protecting how you live right now. And the better your body feels and functions, the more confident you can be that you are on the right track.